Hi, hello everyone. Today we are going to discuss about adenoid cystic carcinoma. The synonyms of the adenoid cystic carcinoma is cylindroma. It's also asked as cylindroma in university examinations. Adenoid cystic carcinoma is slowly growing but aggressive neoplasm with a remarkable capacity of the reoccurrence. It is characterized by proliferation of ductal and myoepithelial cells in cribriform, tubular, solid, and cystic patterns. So, adenoid cystic carcinoma is slowly growing neoplasm. It is also aggressive neoplasm with remarkable capacity of the reoccurrence. And it is characterized by proliferation of ductal and myoepithelial cells in cribriform, tubular, solid, and cystic patterns. The clinical features of the adenoid cystic carcinoma are the salivary gland most commonly involved, parotid gland, submaxillary gland, accessory salivary glands of the palate or tongue, and this tumor occurs during 5th and 6th decade of life. It is most common in females than in males. The symptoms of the adenoid cystic carcinoma are facial nerve paralysis, local pain, paraesthesia. Paraesthesia means abnormal sensation. Abnormal sensation, it may be like tickling sensation. We can remember the symptoms of the adenoid cystic carcinoma by using this mnemonic FLOP. F means facial nerve paralysis, L is local pain, P is paraesthesia, which is abnormal sensation. The histological features of the adenoid cystic carcinoma are adenoid cystic carcinoma is composed of myoepithelial cells and ductal cells, which have following three patterns. There are three patterns of the myoepithelial cells and ductal cells in the adenoid cystic carcinoma. The three patterns are cribriform pattern, which is a classic. It's also called classic pattern. It is the most common pattern seen in the histological features. Tubular pattern, solid pattern is the least common pattern, and the cribriform pattern shows multiple basaloid epithelial cell nests that form cylindrical cyst-like patterns resembling Swiss cheese or honeycomb pattern. So we can see the histological features of the adenoid cystic carcinoma. Here basaloid cells, these are the basaloid cells, they form like a Swiss cheese or honeycomb pattern. These hyalized connective tissue, and this is mucoid material in duct-like space. So this is the microscopic features of the adenoid cystic carcinoma, and this is Swiss cheese like appearance. We can this histological feature resembles the Swiss cheese. So in your university examination, in your 2 marks question, it may be asked as Swiss cheese pattern. It is the histological feature of the adenoid cystic carcinoma. Treatment and prognosis of the adenoid cystic carcinoma is surgical excision followed by radiation. Radiation alone is not recommended. Surgical excision followed by radiation is recommended, and the cure rate is low because of high recurrence capacity. This adenoid cystic carcinoma has remarkable capacity of recurrence, so the cure rate is low. Thank you. Next we are going to discuss about Sjogren's syndrome. It's also known as Sika syndrome.